This is One on One. I'm Steve Adubato. We are honored to have one of the leading heart surgeons in the nation. She is Dr. Margarita Camacho. She has performed over 300 heart transplants in the past 30 years, making her one of the leading transplant specialists in the country. Heart disease is the #1 killer of women and is more deadly than all forms of cancer, causing 1 in 3 deaths a year. Dr. Camacho, thank you for joining us.
It's a pleasure, Steve. Thanks for having me.
Let's talk about this. By the way, before and we'll let everyone know your connection to Newark, Beth and Barnabas Health when we put up your information, but I'm curious about this. When did you know that you wanted to become a heart surgeon?
That's a good question. Back in medical school, I wasn't sure if I wanted to become a pediatrician or an emergency room physician or a surgeon. But when I did my surgical rotation, I loved it. For me, it was a way to take care of a disease right away. And when I did my cardiac surgery rotation, well, that bug just bit me. And I loved it. It was thrilling, it was challenging. And so I'd say back in medical school, about my last year, I decided cardiac surgery was for me.
You know, a few months back at the New Jersey Performing Arts Center, our partners at NJPAC, there was an event in which you were honored, an annual event that Newark Beth has. And you were honored for your work, your team's work in saving lives. I was listening to some of the people, and I see you there accepting the award that night. And I was listening to some of the people who received hearts that you transplanted into them. And they could barely speak, and they could barely describe their appreciation. What is that like for you to hear them say that you've given them life with this new heart?
Well, first of all, there is no way I could do what I do without the amazing team that supports me. And as I often tell them, when I receive an award like that, it's because they've allowed me to stand on their shoulders.
What does it take? Describe what a team of that transplants a heart is. I mean, describe how unbelievably complicated that is.
It's probably the largest multidisciplinary team that exists. Right down from the nurses in the office that screen the patients, the physicians that get together and decide the patient's appropriate. The number of tests that a potential transplant recipient has to go through is just incredible. It'll often take weeks before all those tests are completed. And those are done by, obviously, all the various departments in the hospital. And then we get together as a team and make the final decision that, yes, based on everything, this patient's appropriate.
Or no.
Or no, right.
How hard is that?
That's very difficult. And you know, for all of these people, pretty much, it's the end of the line. So, and
if they don't get the heart?
Well, there are other alternatives or mechanical heart devices that can be placed. And we have a small device now that's been around for almost 10 years, and it's been put in close to 16,000 people. It's allowed them to have a relatively good quality of life.
But is the human heart that it is usually the best option?
Yes.
So I want to go back to that.
So if they are an appropriate candidate, they get listed on the National Registry, which is the United Network Organ Sharing Registry. It's electronic. They're put on the waiting list. Depending on their status, you know, their medical status, they'll be up on the waiting list or low on the waiting list, whatever, but they're on the waiting list and they wait at home. Or they wait in the hospital. Once the call comes that we have a donor, well, that's where it works like a symphony.
The other thing I know about you is you have actually gone out to get the heart.
Yes, I do.
You,
yes,
personally, go out and get the heart.
Yes.
Why?
Because I think it's important. I have a way of preserving the heart. I've done it the same way all these years. We've had very good outcomes. And
how do you get these hearts? Someone has said, when I die, I want to give my heart.
It's interesting because if you talk to donor families, many of them feel that the heart is the most important gift of all the organs. And for us, that's such a precious gift. Because there's a lot of emotion involved with that, with the families. I will never forget years ago when I had to go get a heart from a young college girl. And the father waited for me. And he just wanted to shake my hand and tell me that I had the most beautiful heart that he's ever known. And I have to say that in this field, because I've done this so many years, obviously we're very compassionate and we have a passion for what we do, but it's not often that I get choked up at, at the site and all, and that just really affected me. I thought that highlights, I think, what it's like for families.
We're looking at clinical pictures. It's interesting of the transplant process, the humanity, the humanism, if you will, as we go back and try to match up that part to the clinical part. You never lose that part, do you?
No, you can't. When you're in the operating room, you're concentrating on the surgery. You have to. You're focused.
Right.
If something goes, not the way you expect it, you have to know how to, make things work right, etc. So you have to be truly focused. But at the end of this whole process, you have to understand the gift, the tremendous gift that's been given from a donor to a recipient. And the donor family is very keenly aware of that, and the recipient's family is, so appreciative. This is not just regular coronary bypass surgery or valve surgery. You've given someone truly their life.
Their life.
Right. And so when I see patients after surgery in the intensive care unit, and I congratulate them and I say, you've got such a beautiful heart. Not uncommonly, I get a very big hug, and not uncommonly, they start crying, because it's a very different kind of a gift.
Let me ask you this. I could talk to you about this subject forever because I'm fascinated by all the different, not just clinical sides, but the emotional and human sides of this. Talk to us real quickly about why heart disease is such a powerful killer of women. Why?
Well, women have some other risk factors compared to men. One of them is, for example, postmenopausal. There are hormonal changes that will increase your risk of heart disease. Women are also nurturers. They're busy. They're taking care of families. They have a job while they're doing that. Whatever it is, they don't have time to be sick. And they often present much later than they should. Women also have atypical symptoms, another reason why they present later. They won't necessarily have that classic chest pressure that goes down your left arm. They'll have strange symptoms like pain in the jaw, pain in the teeth, indigestion. And these could all be the symptoms of a big heart attack. So by the time they present to the hospital or to the physician, it's late. And they're more likely to die. Since 1984, that's almost 30 years ago, more women than men started dying from heart disease. And that gap has widened over the last 30 years.
How do we begin to turn this around? Some advice for women as they're watching right now.
Well,
and the men who love them and care about them.
Well, the most important thing is if they have any symptoms of heart disease, like jaw pain, pain in the teeth, indigestion, potentially, they need to seek help. If they feel like they're getting tired more often, especially if they get tired when they're doing strenuous activities, more tired than usual, they've got to go seek help. It may be as simple as a stress test or an EKG, but something should be done. Certainly if they have risk factors in the family. Genetic disease is one of the most important risk factors. If they have parents that have had heart disease or siblings, they have to be screened sooner rather than later.
And public awareness through the American Heart Association.
Yes.
The Go Red campaign, 30
That's
seconds
right.
on that.
That's right. The Go Red campaign by the American Heart Association has really increased awareness among women over the last 5 to 10 years. They have Go Red luncheons in February, which is Heart Disease Month for women, all over the country.
They honored actually Micheline.
Right.
Micheline Davis.
Right.
From Barnabas Health. We were there. There was a wonderful event, and
That's
we were there. Why is that so important for women? By the way, go on the American Heart Association website to tell you all about that.
Yes.
Why is that so important for people to know more about?
Well, because if you raise awareness, the more women will seek help if they have symptoms, or especially encourage family and friends to go seek help if they know they have symptoms.
You love what you do.
I have a passion for it, yes.
And despite all the pressure?
Yes. It can, sure, there is a lot of pressure, but after all these years, there's so many ways to mitigate that pressure, and I have a great team. So.
Dr. Margarita Camacho, you honor us by being here and the work that you do every day.
Thank you so much, Steve.
Thank you. Stay right there. We'll be right back right after this. Thank you, Doctor.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One has been provided by the New Jersey Education Association, Wells Fargo, New Jersey Manufacturers Insurance Group, the law firm of Gibbons PC, Cohn Resnick, and by New Jersey Natural Gas. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System. This program has been made possible in part by New Jersey Institute of Technology.